Good day. My name is Dr. Oluremi Adewale. I would like to speak with you about the coronavirus disease called COVID-19. I will be providing you with some information about the symptoms, spread, and prevention of this virus. Most importantly, I will explore the psychological impacts of being in isolation and under lockdown due to COVID-19. I therefore invite you to watch the whole video. Keep healthy and stay positive. So what exactly is COVID-19? It is coronavirus that comprises of a large family of viruses. COVID-19 in particular is so insidious. The symptoms of COVID-19 range from mild to severe illness consisting of fever, dry cough, difficult breathing, shortness of breath, muscle aches and fatigue. The less common symptoms include sore throat, headache, and diarrhea. Coronavirus is spread by respiratory droplets when an infected person coughs or sneezes. These droplets can be inhaled or land in the eyes, nose, or mouth of someone nearby. This virus has also been found to spread through direct contacts, such as by touching your eyes, nose, or mouth after touching or shaking the hands of someone who is infected by the virus. It can also be from touching surfaces that have been touched by someone who is infected. By now, we all know that everyday preventive actions can help prevent the spread of COVID-19. These actions include washing hands often with soap and water. You can also use alcohol-based hand sanitizer. It's important that you avoid touching your eyes, nose, and mouth with unwashed hands. Avoiding close contact with people who are ill. Stay home if you are ill. Maintain social distance by keeping 2 meters or 6 feet away from others. If you have fever over 38 degrees Celsius, if you have dry cough, difficult breathing, please seek medical care at the first onset of your symptoms. Avoid visiting with people who are elderly or who have compromised immune systems. So now let's talk about the psychological impacts of isolation and lockdown. I recognize that these are extraordinary times and individuals and families have been challenged. Many people are facing financial hardships and health issues. It is very important for people to connect. It is normal to feel overwhelmed, to become worried, and to experience stress and anxiety, which may lead to an inability for people to sleep well. COVID-19 has also contributed to health equity issues and an inability for some groups in the society, such as people with compromised immune system, the elderly, and the homeless, to access basic needs. Volunteering to do simple tasks such as grocery shopping, dropping off supplies, or picking up prescribed medications can go a long way for the most vulnerable. Women are faced with even more challenges in the areas of daycare because daycares and schools are closed. It is paramount to engage in honest conversations with your children to be able to assess their needs and provide support. At this unprecedented time, It is important to stay positive. Staying emotionally healthy and resilient during the COVID-19 pandemic is fundamental to managing stress and minimizing your stress level. If you are experiencing any mental, physical, or emotional distress, please reach out to your healthcare professionals. Access your local mental health resources. Many of these mental health services offer virtual counseling online. You can also call a trusted friend, family, members, or neighbor for support. If you recognize that anyone is mentally stressed out, please reach out and lend a listening ear. By making that call, you never know where you may be saving a life. In addition, please call the stress centers for emotional support if you are socially isolated, if you are struggling with mental health problems, or if you are experiencing distress, abuse, violence, or suicidal thoughts. This is the time to make unforgettable impacts on people's life. Think about the needs of the seniors and those who are vulnerable. Please call to check on them. I encourage you at this time to be your sisters and your brothers' helper, especially now. Find a way to make a difference in other people's life if you are able to. For example, you can consider making a donation to individuals or your favorite organization. You can volunteer at your local food bank or send a gift card to someone. Small acts go a long way for someone in need. It is, however, vital to recognize that the information about COVID-19 is constantly evolving. Therefore, this video is not intended to substitute the expert opinions of public health, Centers for Disease Control and Prevention, and the World Health Organization. Finally, it is very important to take care of yourself at a time like this. Remember to secure your own oxygen mask before supporting others. Human beings are resilient. We will get through these difficult times together. We are stronger when we support one another and work together. I invite you to take care of yourself. Be safe. Practice physical distancing and stay connected virtually. We will see the light at the end of the tunnel. Please take care of yourselves and others. May the Lord bless you. Thank you.